Baystate Health recently announced plans to open a system-wide behavioral health hospital. The potential consolidation of services has some advocates in Franklin County concerned regarding keeping local care local in communities and around the Greenfield area. To discuss the issue, Carrie Saldo sat down with the Vice President of Strategy and Business Development for ServiceNet and the Chief Operating Officer for the Center for Human Development to find out more.
Well, my first reaction was, I think there are two things that came to mind. One is I'm grateful they're not abandoning the situation and just closing the units without this centralized facility that's been proposed. And then I also can certainly understand the sense of loss in the localized access.
Yeah, because there are right now beds at 3 different locations outside of Springfield, in Westfield, Greenfield, and in Palmer.
Right.
And we should say on balance that we did invite Baystate to come in and chat with us today. They declined and said, go ahead and move ahead with your conversation on your own. And the other piece, they don't have a location for this hospital as of yet. And they think that once a site is selected, it'll take about 2 years. So I don't want people to hear this conversation and think this is happening tomorrow. There's going to be some time before this moves forward. Lois, for you, reaction to the news that Baystate will be consolidating in this way?
I think that it seems like Baystate has given some serious thought to the idea of having some centralized access to inpatient stays. And I think that we all know that it's been a challenge to provide enough beds across the state or even regionally for individuals who are struggling with behavioral health issues. So I think to Baystate's credit, it's taken a step forward to address the challenge that we have. I think, what's most important is really what happens after individuals leave their inpatient stays and how services are provided for them so as to continue with the continuity of care as well as to prevent readmissions.
To your point about continuity of care, both CHD and ServiceNet have residential homes where people who are struggling or being treated for different mental health issues can go and get services, right? So let's talk a little bit about that to help people at home understand. Is it typical that someone, if they're experiencing a mental health challenge, would go to a more formal hospital like Baystate or somewhere in the Berkshires, you would receive different treatment, and then once you've had your hospital stay, you come to a residential facility? Is that how it works? No, please.
No, I mean, it's a much more formal procedure. So most of the residential beds, the longer-term residential beds that you're referring to are state funded. And so they go through the state funding agency. The admission process goes through the state funding agency. So if somebody were inpatient and had significant enough needs to warrant applying for those beds, then there's that capacity challenge as well in terms of those. But the larger system of care, now I'll let Lois chime in, has other supportive functions. So the standard outpatient care is very carefully coordinated and has been for many years. So nobody leaves an inpatient stay without follow-up appointments in their local community at the based on their insurance, et cetera. And in addition, and this is something that CHD and ServiceNet have partnered on, it's a new program that just started this fiscal year, called Community Partners. And this, again, is for high-need individuals who might be in the category that you're talking about. And I'll let you continue the conversation so I don't keep going.
No, it's okay. I mean, it's a really good question, Carrie, because there are different levels of care. And so, for example, CHD finds itself in all the counties of Western Mass. And so there are services that we provide from the most intensive to the least intensive. So there are individuals who have been in inpatient stays that get transitioned to lower levels of care. So for example, we have a number of recovery homes for both adults and children, and I think ServiceNet does as well, where individuals who, for example, who have been in inpatient stays for substance abuse can transition into these recovery homes so that they can continue their path of recovery and also be assisted with addressing the social determinants in their lives that often act as barriers to good both primary care and behavioral health care. So in addition to that, to the cadre of services that we provide, we have outpatient services that can be obtained both in the office and in their homes for both children and adults. We have a community-based health initiative, we have early intervention. So there are many services that we can provide for families. One unique service is our community support program, which is designed to help people while they're in inpatient stays make the transition of care and follow them into the community and ensure that they're attending all their outpatient appointments, have the resources they need.
Do we know anything about the nature of where the demand is currently? Is it in Franklin County? Is there more larger need in Springfield, for instance? Do we know?
I mean, besides the population density being related to the demand, other than that, I don't have any information that would indicate that a particular area is more vulnerable than another.
Yeah. Anything, Lois?
I would have to agree with that.
Okay. And the other thing is that Baystate has said that children's services, teen services, and adult services would be put under that one roof. What do you think about that decision?
Well, I think not knowing what Baystate's intention is in terms of the setup of the facility, it's an inpatient hospital, it's an inpatient stay, and I'm sure they'll make accommodations as appropriate as many hospitals do in their facilities.
Is that unusual, though, to have those treatment services for that? No, not.
No.
Yeah. And so currently, the way that I know that CHG, one of the things that is offered is that teens can have, or adolescents can have, in-reach, where, as I understand it, to come to the home. Is that something entirely different, or what is that program all about?
No, I think you're referencing what I just mentioned, the community-based health initiative. So
yes.
it's in-home therapy for children who have some serious behavioral issues that impact the functioning in their lives, where clinicians can go into the home and provide services not only to the child, but also to the family. So if there are family members involved, they look at how the family is working together, what kinds of supports they need, what kinds of supports are needed in the school as well. And so that's their objective. And so all of the services that we provide on an outpatient level are available to individuals both on a preventative level as well as post-discharge as part of their transition of care.
Just one last quick question for each of you. In terms of Baystate making this decision to consolidate the hospital, do you foresee that CHD or ServiceNet would change the way that you offer these behavioral health or mental health treatment services because of it?
Not because of that, but the changes, so not to confuse two things, change is coming separate from this.
In what way?
Well, the Medicaid system is in a huge state of change, and it's going to take the next probably 3, 4, 5 years to really realize all of it. But the state is no longer financially, and we've moved to accountable care organizations, integrated care. So a whole new approach looking for those most vulnerable populations who are Medicaid recipients is. So we're looking at big changes, like from a provider standpoint, you might not be reimbursed the same way as you have been for many, many years. And then the more integrated approach to medical and behavioral health care coming together.
Do you know at this point if that means less care for people or less access to care?
We don't know. The answer would be, I think the intent is more access.
And more coordinated
And more
care.
coordination.
Right.
So you go to your primary care and they're going to be integrated into the same record as your therapist and all the other services. So the much more global approach to what's going on for each person.
And Carrie, I don't think we're going to see any immediate change in how we work with Baystate or any other hospital. I think the partnership that we have will continue to be enhanced, and I think that partnership is important for all the reasons I already mentioned, that it's really important to engage with the folks that are in these inpatient stays to provide them with the resources they need once they're discharged and they're in the community, both to themselves and their families, because their caregivers are part of some of the challenges that they experience. So it's really important to continue to utilize those community-based resources, and I think that's where we can be the greatest asset to both the hospitals as well as the patients in the hospital.